Hello, I'm Tina Touchton, and today I will be talking about dissociative disorders. There are three types of dissociative disorders. Dissociation happens when somebody has experienced very serious trauma, often childhood repetitive trauma, so they learn how to disconnect. According to the American Psychiatric Association, the three types are dissociative amnesia, dissociative identity disorder, also known as DID, and depersonalization or derealization disorder. Of the dissociative disorders, I decided to speak about dissociative identity disorder, or DID. Many of you may know it as a multiple personality disorder. The first documented case of DID was in 1584. Although it wasn't labeled DID at that time, Jean Ferry recorded her exorcism and had many of the same symptoms that individuals with DID have today. According to Bethany Brand, PhD, DID is a developmentally based trauma disorder that starts very early in childhood due to repetitive abuse occurring before the age of 6. As a reaction to the repetitive trauma, the mind creates the different dissociative self states, also known as alters or identities, as a way to dissociate and not think about the horrible stuff. She also states that most people are misdiagnosed as having schizophrenia or bipolar disorder due to hearing voices or the mood shifts. Frequently, when a person goes in for treatment for DID, they also have other disorders such as severe depression, post-traumatic stress disorder, substance abuse problems, eating disorders, and sleep problems. For DID diagnosis, there are self-report questionnaires that a clinician can use and also standardized evidence-based interviews. For treatment of DID, most often it is therapy-based and happens in 3 phases. Phase 1 focuses on stability and safety, working through the associated disorders such as depression and sleep problems. Phase 2 is a focus on the trauma processing and grieving about the trauma. Phase 3 is working on living a full life, having healthy relationships, and establishing or furthering a career. Medications can be used for the disorders, and brain scans have been integrated into research and diagnosis of DID. Some movies and television shows known for the portrayal of DID are Split, Sybil, Primal Fear, Fight Club, United States of Terror, Mr. Robot, and Monsters Inside the 24 Faces of Billy Milligan. These movies and TV shows portray the individuals to have dramatic and sudden switches between the alters or identities. According to Brand, less than 5% of cases actually have dramatic shifts like the media portrays. She says it's exaggerated in movies and TV for the audience to be able to tell what is going on. Most often, men with DID are portrayed as serial killers or monsters, and women with DID are portrayed as sex fiends. Because of these stigmatized stereotypes of DID, most patients end up hating themselves and don't want their clinicians to know about their disorder. These are the references I used for my information.